Stanford Medicine researchers have unveiled an exciting innovation in the field of cancer care, a cutting-edge AI model called MUSK. This breakthrough system integrates both medical imaging and text data to predict cancer outcomes with unprecedented accuracy. Imagine a tool that not only examines the scans of a patient but also incorporates the critical details from their medical records to offer a comprehensive analysis. MUSK does exactly that. What makes MUSK so revolutionary is how it surpasses traditional methods in predicting patient survival rates across a variety of cancers. It doesn't stop there. The model also excels in identifying which patients are most likely to benefit from immunotherapy, a type of treatment that can be life-changing but isn't universally effective for everyone. By pinpointing the right candidates for this treatment, MUSK has the potential to save valuable time and resources, not to mention improve patient outcomes significantly. The technology behind MUSK relies on what's called a foundation model approach. In simple terms, this allows the system to be trained with much less labeled data than traditional AI systems. This efficiency is a game changer, particularly in a field like oncology, where high-quality, labeled datasets are often difficult to come by. Another standout feature of MUSK is its ability to process and analyze diverse types of data. Traditional methods often focus solely on imaging, like CT scans or MRIs, or text data, such as patient histories and pathology reports. MUSK brings these elements together, creating a holistic view of the patient's condition. The result? Prognosis predictions that are far more accurate and actionable than those derived from using either imaging or text data alone. This is a significant leap forward in precision oncology. MUSK empowers clinicians with deeper insights, potentially transforming the way cancer treatment decisions are made. No longer are doctors limited by siloed data or one-size-fits-all approaches. Instead, they have access to a robust tool that personalizes treatment strategies with unparalleled precision. In the grander scheme, MUSK is more than just an AI model. It represents the future of how technology and medicine can work hand in hand to improve lives. By streamlining the diagnostic and decision-making process, it could pave the way for a new era in cancer care, one where patients receive not only faster but also more effective treatments tailored to their unique medical profiles. Stanford's development of MUSK isn't just a step forward, it's a leap toward transforming oncology as we know it, giving patients and clinicians a powerful ally in the fight against cancer.